Okay, let's get right into it. We're doing a deep dive on the December 15th, 2025 executive order, the one that labels illicit fentanyl and its precursors as weapons of mass destruction.
Right. And our mission today is really to be surgical about this. We're not, downplaying how lethal fentanyl is. That crisis is real. But for anyone in policy and law and public health, you have to ask, is this EO based in constitutional law? Is it based in evidence?
So let's start right there with the constitutional friction. Weapon of mass destruction is a legal term. It's defined by Congress in a federal statute.
Exactly, with enormous penalties attached.
So can the executive branch just redefine that by signing an order?
Short answer is no. Fundamentally, it cannot. The power to define what a federal crime is and what the penalty is, that belongs to Congress. That's Article 1 of the Constitution.
So an executive order can't just rewrite a statute.
It can't. And the order itself basically admits this. It says it has to be implemented consistent with applicable law.
And the law is clear. The WMD statute requires a specific intent to use a weapon as a weapon.
Right? Something designed to cause mass harm. Selling drugs, no matter how dangerous, just doesn't meet that legal standard.
But the argument from the administration must be that the scale of the crisis justifies it, that this is an emergency.
And that's an argument we've heard before. Courts have put very clear limits on it. You can go all the way back to Youngstown, Sheehan, Tubco v. Sawyer. The Supreme Court said the president can't just legislate, even if they call it national security.
There's also that other case, Bond v. United States.
Yes, that's a crucial one.
The court basically rejected an attempt to apply a chemical weapons treaty to what was essentially a local crime.
Yeah, exactly. They warned that if you stretch these national security laws that far, you erase the limits on federal power. You start federalizing all kinds of ordinary crime.
So if the EO can't actually amend the law, what is it? Is it just symbolic?
Legally, yes. In a sense, it's symbolic. It's not operative. I mean, courts are very unlikely to uphold a WMD charge for drug distribution.
But the symbol itself has power.
Immense power. It's a signal. It authorizes prosecutors and police to be more aggressive, to pursue the harshest charges possible. It changes behavior, even if it doesn't change the law.
Which sounds an awful lot like a rebranding of the war on drugs.
It's the same playbook. It is absolutely the same logic. You frame a public health crisis as a national security threat, and that justifies punitive escalation.
And we know what that does. It shifts resources.
Dramatically.
Right.
Away from treatment, away from mental health care, away from the community prevention that we know actually works. And it shifts it all towards surveillance, interdiction, a militarized response. History shows us that path leads to racialized harm and, frankly, an erosion of civil liberties.
So if the real goal is to save lives, to reduce overdose deaths, the public health data is not on their side with this approach.
Not at all. The evidence is unambiguous. Harsher enforcement does not lead to fewer deaths. And here's where it gets really stark. A 2025 study. It looked at thousands of drug seizures in San Francisco. It found that in the 100-meter area, right around a seizure, fatal overdoses were 74% higher.
74%, the very next day.
The next day. That one data point just completely undermines the entire logic of supply-side enforcement.
Because it destabilizes the market.
It makes it unpredictable. People seek out new sources, the potency is unknown, and the risk just skyrockets. On top of that, this kind of fear-based enforcement with things like drug-induced homicide laws, it makes people afraid to call 911.
Even with Good Samaritan laws in place.
Even then. And we haven't even touched on what happens post-incarceration. People coming out of jail or prison, their tolerance is lower, their care has been disrupted. They face an incredibly high risk of fatal overdoses.
So the escalation itself predictably increases the very harm the policy claims to be solving.
Yes. And the contrast with what does work is so clear.
You can look at international examples.
Sure. Look at Portugal. They decriminalized possession. They invested heavily in social support and treatment. Deaths fell. HIV infections fell.
Or Switzerland with heroin-assisted treatment.
Right. Illicit use went down, crime went down. The evidence is there.
And we see the same pattern right here in the U.S., don't we?
We do. The jurisdictions that are expanding access to naloxone, to syringe services, to low-barrier treatment, they are the ones seeing progress, not the ones focused on arrests.
Which brings us back to the core of this. This isn't really about minimizing how deadly fentanyl is.
No, not at all. It's about choosing evidence over symbolism. The choice is, do we repeat the failures of the past, just with a new, legally shaky label?
Hmm?
Or do we finally apply the clear, settled public health evidence that we know saves lives?
Because at the end of the day, applying war rhetoric to a public health crisis has a perfect record of failure, and the data proves it. The goal has to be applying the evidence, not the symbolism.